Welcome students. Today I'm going to discuss the properties, basic features and medicinal attributes of Digitalis. This is the image of the plant Digitalis purpurea, a plant of the family Scrophulariaceae. This is a very important family which shows their plants mostly with herbs or they are undershrubs and in some cases rarely trees. These plants or plants of this family show their leaves with alternate or opposite, rarely whole or simple in nature. Inflorescence racemose to cymose. The flowers are bisexual, usually zygomorphic, or very rarely actinomorphic, like Scoparia. Fruit usually capsule-like, in some cases berry also, and the seeds with endospores. Some of the common plants of this family includes Lindenbergia indica, Limnophila heterophylla, which is very important as it is a typical example of heterophyly, that is, development of two types of leaves. One is dissected and another one is complete. And obviously, Digitalis purpurea, which is very important for its medicinal properties. Now, we must encounter its pharmacognostic features or pharmacological attributes. Usually use the particular species Digitalis purpurea, commonly known as foxglove or fairy cap. The pods used mostly for the glycosides, the dried leaves. And already I mentioned the chemical class of the pharmacological property, Digitalis glycoside. Now, usually, although we are very synonymous or very popular, known as Digitalis purpurea, but also Digitalis lanata can be used for this purpose also. The chemical constituents of this Digitalis lanata and Digitalis purpurea. Here I only want to mention about the Digitalis purpurea mostly. There are three types of glycosides which we have to remember: perlanoside A, perlanoside B, and digitoxin. These three are very, very important. And pharmacological actions includes treatment of congestive heart failure. And how this works? Digitoxin shows its action by sodium-potassium ATPase. It increases the contraction of the heart muscles and decreases the heart rate. By lowering the heart rate, this special drug can prevent heart failure. Then, to relieve the atrial fibrillation, that is, digitoxin, or especially digoxin, slows the heart rate by blocking the electrical impulses that passes through the AV or atrioventricular node to the lower heart chambers. But we have to take some precaution because there are some interactions with other medicines or other compounds like laxatives, quinine, etc. Laxatives interact with digitalis in one way. Digitalis affects the heart by using the potassium, while laxative can also decrease the level of potassium in the body. So low potassium level can increase the side effects of digitalis. Similarly, quinine interacts with digitalis, while digitalis affects the heart. Taking quinine along with digitalis might cause some serious consequences. Other side effects includes loss of appetite, nausea, vomiting, loss of vision, change of heartbeat, either tachycardia or bradycardia or irregular one, etc. The dosage includes for digitalis purpurea is 20 nanogram per milliliter, and if we want to use it purified, digoxin is typically used as a daily dose of 0.125 to 0.25 milligram. Now, other contradictions. Compounds that have absorbable calcium, when used, always decrease the dose of cardiotonic glycosides. Drugs that cause the depression of potassium within the cell should be used in caution with cardioglycosides. Digoxin is contraindicated with patients having ventricular fibrillation. It should be used with caution during pregnancy and breastfeeding. Other associated toxicity includes abdominal pain, fatigue, ventricular tachycardia, ventricular fibrillation, and hyperkalemia. So, we must use cautiously the Digitalis purpurea under medical supervision, and these are the references. For much more information and much more understanding of the particular topic, you can also visit these sites also. Thank you.